one of the cartilage, knee, and sports surgeons here at Orthopedic Specialists of Seattle. Today we're going to show a video testimonial. This is a young gentleman, 30 years old, came in with a pretty complicated problem, had 4 surgeries previously for kneecap dislocations, as well as a little bit more of an unusual finding. On top of the kneecap dislocations, he had lost a bunch of cartilage both on the groove or the trochlea as well as on the patella. But what was even more unique is he also had a pretty large defect of the condyle, which is called an OCD. And to have those two together is pretty unusual and rare. And I think that was why previous people he had seen were kind of confused, and also it was a little more challenging to take care of him. So we ended up doing a combined procedure. We took care of the cartilage on both the trochlea and the patella. In addition, we did an MPFL reconstruction, and we also did an osteotomy or tibial tubercle osteotomy to realign his kneecap. And that took care of most of the kneecap issues, but we also had to take care of the OCD of the medial condyle, and so we ended up doing a cartilage transplant at the same time. And you can see it's a lot of surgery. It was a long recovery, but he had a really good result, and hopefully you enjoy the video testimonial. Thanks.
When I was a sophomore in high school, I dislocated my knee playing basketball, and ever since then it was dislocating reoccurrently. I mean, all the time. It was like every game, every couple of months I'd dislocate it. I'd be out for a couple of weeks. You know, cartilage would break off. I'd have to have a scope knee surgery to basically go and clean it up, and it was just a reoccurring issue for me, and there was consistently pain in my left knee for years. I had had surgery 4 different times to try to fix the issue, but it was just reoccurring, and simply just the pain was nonstop. When I saw Dr. Garcia, he had a different approach, took a more assertive approach where basically they fixed the underlying issues that corrected everything. So from the onset with Dr. Garcia, he was very, very transparent, confident, and assertive with his approach, which in turn gave me confidence, because like I said, I had seen 4 different knee surgeons, all of whom had seen the issue, and you could tell there was hesitation with their approach and how they were going to basically tackle it. But Dr. Garcia took something very, very complicated, made it simple, and throughout the whole process, I felt confident that we were on the right path. And not only that, he was accessible and available throughout the whole thing. I've never had a knee surgeon that I've been able to basically call and get an answer from almost immediately. You feel really comfortable and confident that we were on the right road. Well, pre-Dr. Garcia surgery, I wasn't able to play a full round of golf, 18 holes, without pain. I wasn't able to go on walks with my wife more than a mile without pain. I wasn't able to play basketball at all without pain. Now I'm able to play golf. I'm able to go on walks, 4 or 5 miles a day, no issues at all. I'm still a couple of months out from playing heavy basketball, but I'm confident that I'm now building on a foundation that is stable, and building strength back on a foundation that I can rely on. So honestly, I'm so happy to be 30 years old and have a knee that I can rely on and not have to think about full knee replacement surgery 5 years from now, which, before seeing Dr. Garcia was kind of what I was thinking was the next step, unfortunately. So I'm thrilled. I mean, I feel very lucky to have met him, to be here and to have gone through this process.